Cholera is a food and waterborne disease caused by the ingestion of the bacterium Vibrio cholerae in contaminated water and food. We first spoke to some medical practitioners to understand what cholera is and how it spreads.
So it's a disease that is caused by a bacteria that mainly or largely affects the digestive system. And what it does is it gets into the system and then it causes a lot of abnormality in the digestive system, resulting in passage of frequent watery stool.
How long can someone be stooling if you're down with
If you are down with viral cholera, you can be down till at the peak of when you are about recovering. That is when the stool will stop. And
so you keep stooling frequently?
you keep stooling frequently.
Wow.
But the vomiting and the nausea will be within some hours.
So immediately I'm down with cholera. How will I as a person know? What are the primary signs that should let me know that probably I'm down with cholera?
Weakness of the body, vomiting, diarrhea, severe diarrhea. What I mean severe diarrhea? In fact, when you start passing out stool, you will feel like not to stop.
From the interaction with the experts, preventing the infection or its spread is strongly dependent on personal hygiene and environmental sanitation. This means that the open dumping of refuse, drinking water from unknown sources, eating street foods, and overcrowded areas fuel the spread of cholera. A visit to some areas in the nation's capital, Abuja, revealed that all these preventive measures are not being taken seriously, making people prone to the infection. Food vendors were seen selling food in an unhealthy environment, while customers ate food in open spaces. At the Federal Secretariat, an area that houses most government ministries and agencies, workers were cited buying and eating food in open spaces, a situation many public health experts have condemned.
Before you go to a particular point or a particular place to go and eat, you should have know how well the person cook and how the person is good in hygienic control. So before you go to that place, you should have understand how this person tends to prepare his or her food so that it can prevent you from picking this organism, this bacteria from one place to the other, because you may discover that you're not the only person that eat food in that area.
Food vendors, those are also medium by which people get that. Now, some of these food vendors, you are not sure of the quality and the purity of the water they use, and even the person preparing it, you don't know how their hygiene state is. So they just prepare the food, and then the food may not be stored properly.
News Central crew also visited the Mpape community, and the situation is not different from the Federal Secretariat. We observed a massive heap of refuse dump, and we caught on camera people defecating openly.
People living in areas with poor sanitation, such as this one you're seeing, are mostly susceptible to cholera. As you're aware, flies are vectors, and when they perch on these particles, you cannot fathom how long they can travel to get your open water or food contaminated. Unfortunately, we are in the raining season, and whenever it rains, it can carry particles from this place to open water sources. And then when you fetch water from those sources, you can easily get infected. Now, if you look closely, houses around this area are just a few meters away from this dump site. And the big question is, what will become the hygiene of people living in this area? Where I am is called Mpape, a suburb of the Federal Capital Territory, Abuja, Nigeria's capital.
there's this frequent practice we do, especially in some of the rural areas and suburban areas, where people defecate on farmlands and outside. Now, they do that during the dry season, and then the soil absorbs some of those, they dry, they decompose, and then during the rainy season, it's washed them down to streams, and then it goes down. Now they can percolate the soil up to some of the wells or boreholes.
While cholera can lead to mortalities, experts say children are in danger of being affected.
Why are children more vulnerable to it?
Yes, because their immunity is low. Children and old age, young, that is old age people, they are more vulnerable because of their immunity is weak. It's not as strong as you as an adult that you are more active. So they can easily go down with it. And moreover, children need fluid than you. So you discover that the worst thing that the cholera does is when you are passing out the stool, you are losing more of your ions and the fluid in the system, so you become dehydrated.
The situation on ground is not far from what is obtainable in other parts of the country where there have been reported cases and deaths. Available data says that in the last 4 years, about 4,364 people have died from cholera in the country, while another 139,730 Nigerians have been suspected to have been infected. Health experts have called on the Federal Capital Territory Administration to visit local councils in the capital and ensure the issue of waste management, open defecation, and access to clean water are tackled, especially as its neighboring Niger and Nasarawa states have recorded cases of cholera. In Abuja for News Central, Marvelous Oboman.